If you are over 65 and you take supplements every day, I need your full attention for the next few minutes. Most people in this age group do not take just one pill. They take a handful, a multivitamin in the morning, calcium for bones, iron for energy, something herbal for mood, something extra for heart health because the label sounded safe. No prescription, no pharmacist, no warning that one capsule can change how your blood clots, how your nerves function, how your kidneys filter, or how your medications work. And that is the problem. After 65, the same supplement that looked harmless at 45 can become a slow mistake you do not feel until the damage is already underway. I am your doctor, and I want to walk you through 5 supplements I would never take after 65, unless there was a clear medical reason, lab evidence, and a physician actively monitoring the decision. Not because every supplement is bad, not because food cannot help, not because your intentions are wrong, but because age changes the math. 3 things shift in your body after 65. First, your liver processes compounds more slowly than it once did. That matters because supplements are chemicals too, even when they come from plants. Second, kidney function tends to decline with age, which means byproducts can stay in circulation longer. Third, medication load rises. Many adults over 65 take several prescription drugs at the same time. Every supplement added on top of that increases the chance of a collision nobody planned for. That is why this matters. The danger is not only what a supplement does by itself, the danger is what it does inside an older body that is already processing blood pressure pills, cholesterol drugs, blood thinners, thyroid medication, acid reducers, diabetes medication, sleep aids, or pain medicine. By the end of this, you will know which 5 supplements worry me most, why they become riskier after 65, and what to do instead. Number 1. Iron. If you are taking iron because you feel tired, weak, or cold, please stop and think before you take the next capsule. Iron is not a harmless energy booster. It is a mineral your body needs in the right amount and can suffer from in the wrong amount. Before menopause, regular blood loss made excess iron less common in many women. After 65, that protection is long gone. Men never had it at all, and older adults are often more likely to have normal or even elevated iron stores than true iron deficiency. The problem is that the body has no easy built-in way to get rid of excess iron. When iron accumulates, it does not sit quietly. It can irritate the stomach, worsen constipation, reduce zinc absorption, and in higher burdens contribute to oxidative stress that damages tissues over time. The organs that tend to pay first are the liver, the heart, and the pancreas. That means a supplement someone started for fatigue can end up feeding a problem they never knew they had. And fatigue is a terrible reason to self-prescribe iron, because fatigue has dozens of causes after 65. Poor sleep, thyroid problems, low B12, depression, medication side effects, heart disease, anemia of chronic inflammation. If iron is not the problem, iron will not fix it. It will only add another burden. One blood test changes everything here. Ferritin helps estimate iron stores. Sometimes your doctor will also order transferrin saturation and a complete blood count. That is how you find out whether you need iron or whether iron is the last thing you should be taking. Guessing is not medicine. Guessing is gambling with a mineral your body cannot easily unload. Before we go further, remember this. The supplement label is not written for your age, your medication list, your kidney function, or your recent lab work. It is written to sell a general promise to a general audience. Supports energy, supports immunity, supports mood, supports bone health. Those phrases sound helpful because they are vague on purpose. What they do not tell you is whether the product still makes sense in a body that is processing 5 prescriptions, recovering more slowly, and carrying risks that were not there 20 years ago. There is another reason iron worries me after 65. Many older adults assume that if a multivitamin contains some iron, then extra iron must be fine too. That is how accidental stacking happens. A fortified cereal at breakfast, a multivitamin at lunch, a dedicated iron tablet in the afternoon. Suddenly the daily total is far higher than intended. Meanwhile, the real cause of fatigue may be low thyroid function, sleep apnea, heart failure, dehydration, chronic kidney disease, grief, or medication timing. The body does not care that the intention was good. If iron is unnecessary, the excess still lands somewhere. Vitamin E creates a second trap I see often. People think of it as protection against aging itself, almost like a shield against wear and tear. But aging bodies are not helped by random megadoses. In fact, older adults are exactly the group in whom bleeding complications matter more, because falls are more dangerous, surgeries are more common, and blood thinners are everywhere. A supplement that quietly nudges clotting in the wrong direction may not announce itself until the bruise is larger, the nosebleed lasts longer, or the emergency room doctor is asking what else you take besides prescriptions. St. John's wort has another feature people underestimate. It does not just interact with one category of drug. It can touch several systems at once, which makes the problem hard to notice in real time. Maybe the statin seems a little less effective. Maybe the sleep medicine feels different. Maybe the anticoagulant level drifts. Maybe the antidepressant combination creates strange restlessness. Because the changes do not always happen dramatically on day one, people keep taking it and assume everything is fine. That is exactly why it is risky. Slow problems are easy to miss. With calcium, the biggest mistake is treating a bone concern like a calcium deficiency by default. Bone loss after 65 is real. Osteopenia is real. Osteoporosis is real. But the correct response is targeted, not automatic. Some people need more dietary calcium. Some need vitamin D correction. Some need strength training and balance work. Some need an osteoporosis medication because the fracture risk is already high. And some are already getting enough calcium from food and simply adding tablets on top. When the strategy is lazy, the result is usually more pills, more constipation, and more confidence than the evidence deserves. Folic acid becomes even more concerning when you remember how common B12 problems are in older adults. A person can feel mentally slower, less steady, more forgetful, more numb in the feet, and more fatigued, and everyone around them may blame age. Then the high folic acid intake keeps the blood count from revealing the full picture early enough. That is the part I hate most. A preventable deficiency starts borrowing time from the nervous system while the outside story still sounds ordinary. By the time someone finally gets the right test, they are asking whether the damage can be reversed completely. If any of this sounds familiar, good. It is supposed to. These are not rare, exotic products from some obscure website. They are ordinary supplements sitting in ordinary homes, taken by thoughtful people who genuinely want to stay healthy. That is why the risk is so underestimated. Nobody wakes up intending to harm themselves with a wellness routine. They do it by trusting that if something is sold over the counter, marketed as natural, and used by millions of people, then it must be safe enough to take indefinitely. After 65, that assumption becomes dangerous. So when I say these are 5 supplements I would never take after 65 without a very specific reason, I am not trying to scare you away from every bottle on the shelf. I am trying to replace blind habit with informed caution. Your body deserves specificity at this age. Specific diagnoses, specific lab work, specific dose decisions, specific review of interactions. That is how safe medicine works. Everything else is guesswork dressed up as prevention. Number 2, high-dose vitamin E. This supplement built its reputation decades ago on the promise of antioxidant protection. People heard that antioxidants fight damage, so more must be better. That logic sold an enormous number of capsules, but biology is not impressed by marketing. At higher doses, vitamin E stops looking simple. Large supplemental doses can interfere with normal clotting. They can inhibit platelet aggregation and push bleeding risk higher, especially in people already taking aspirin, clopidogrel, apixaban, rivaroxaban, or warfarin. In other words, the person most likely to buy a heart health supplement is often the exact person most likely to get hurt by it. There is a second issue. Studies have raised concern about increased risk of hemorrhagic stroke with vitamin E supplementation. That means bleeding in the brain, not a minor nuisance. Some analyses have also linked high-dose supplementation to small increases in all-cause mortality, and one major trial found increased prostate cancer risk in men taking 400 international units a day. That is not a profile I want anywhere near a routine daily supplement plan for someone over 65. Food is different. Vitamin E from nuts, seeds, and vegetables comes in amounts your body is designed to handle within a complete dietary pattern. A large capsule is different from a handful of almonds. After 65, I would rather see vitamin E on your plate than stacked in your pill organizer. If you are learning things here that nobody ever explained clearly, subscribe to Wellness Daily, because this channel exists for exactly that reason. Number 3. St. John's wort. This one scares people less than it should because it is sold as an herb. Herbal does not mean mild. Plant-based does not mean interaction-free. St. John's wort is one of the most important supplement interaction traps in the entire store. Its key compounds can ramp up drug metabolizing systems in the liver and transport proteins in the gut. Translation: it can make your body clear other medicines faster than intended. That means the prescription you rely on may stop reaching the level it needs to reach. The bottle of herbs looks harmless. The interaction is not. If you take a blood thinner, a heart rhythm medicine, a statin, a transplant medication, an HIV drug, birth control, a seizure medication, or certain antidepressants, St. John's wort can become a serious problem. It can weaken the effect of some medicines, intensify the danger of others, and when mixed with serotonergic antidepressants, it can contribute to serotonin syndrome, a potentially dangerous state involving agitation, sweating, rapid heart rate, tremor, and in severe cases much worse. Now add age. After 65, the average person is often taking multiple prescriptions from multiple doctors. One for blood pressure, one for reflux, one for sleep, one for mood, maybe more. That turns St. John's wort into a wild card that can rewrite the plan without anybody realizing it, especially if the patient never mentions it because they do not think of it as a drug. If your emotional health needs support, I take that seriously. But a supplement that can destabilize several medications at once is not where I would start after 65. Number 4. Calcium taken routinely, without a clear plan. This one surprises people, because calcium sounds unquestionably healthy. Bones need calcium. Older adults worry about fractures. So the leap feels obvious. Buy a calcium supplement and protect yourself. The problem is that the evidence is not that clean, and the risks are not zero. Some studies show calcium supplements can help bone density under the right circumstances, especially when intake is low and the overall plan includes vitamin D, exercise, and medical guidance. But that does not mean every adult over 65 should automatically swallow large calcium tablets every day for years. Supplemental calcium can increase the risk of kidney stones in some people. It can also contribute to constipation, bloating, and pill burden. More importantly, research on cardiovascular outcomes has been mixed enough to make routine, unguided supplementation something I do not treat casually. If your diet already provides enough calcium, adding big supplemental doses may not give you the benefit you think it will. And there is a bigger misunderstanding. Bone protection is never about one pill. Bone strength depends on resistance training, protein intake, vitamin D status, fall prevention, balance, medications that affect bone, smoking history, alcohol intake, and sometimes prescription osteoporosis treatment. Calcium gets treated like the whole answer when it is only one small piece. If you truly need calcium, the right question is not, should I take some? The right question is, how much calcium am I already getting from food? What is my kidney stone risk? What does my bone density show? And what plan actually fits my body? That is a medical conversation, not a grocery aisle decision. Number 5. High-dose folic acid, especially when nobody has checked your B12. This is the quiet one. Folic acid is the synthetic form used in many supplements and fortified foods. Folate itself is essential. The issue is not that your body does not need folate. The issue is what happens when high folic acid intake enters the picture while vitamin B12 deficiency is developing in the background. After 65, B12 absorption often gets worse. Stomach acid tends to decline. Some people make less intrinsic factor. Others take acid-reducing medications, or metformin, which can further complicate B12 status. The deficiency can build slowly for years. Normally, one of the clues is megaloblastic anemia, but high folic acid intake can partially correct the anemia signal while doing nothing to stop the neurologic damage of low B12. So the lab clue gets blurred, the blood count may look less alarming than it should, and the real problem keeps advancing. Meanwhile, the nerves keep suffering. Tingling in the feet, numbness, balance problems, memory changes, brain fog, weakness. In some cases, damage becomes very hard to reverse. That is why I do not like older adults casually piling folic acid on top of fortified cereals, breads, and a multivitamin without asking whether B12 has ever been checked. If a supplement is going to be part of the plan, I want the whole picture first. Let me make this real. Picture a 68-year-old man who starts taking iron for tiredness, vitamin E, because he read it was good for the heart, St. John's wort because he feels low after retirement, calcium because his neighbor swears by it, and a high folic acid multivitamin because it says complete senior support. 6 months later, he is constipated, bruising more easily, his INR is unstable, his feet are tingling, and he assumes aging is simply catching up with him. That is how this happens. Not with one dramatic event, with a stack of small decisions that all sounded reasonable at the time. One more pattern I want you to watch for is symptom mislabeling. After 65, people often explain away new problems with one sentence: I am just getting older. But older is not a diagnosis. New bruising may be a bleeding issue. New numbness may be a nerve issue. New constipation may be a supplement issue. New fatigue may be a lab issue. New confusion may be a medication interaction. When supplements are involved, vague symptoms deserve sharper questions. What changed? When did it start? What bottle was added? What dose increased? What prescription was already on board? That habit alone can save months of silent damage, because the body usually whispers before it screams. And the older the body, the less room it has for casual experiments, because recovery is slower, interactions are common, and hidden deficiencies cost more. Here is the action list. First, gather every supplement bottle in your house today. Not tomorrow, today. Second, read every label and circle 5 things: iron, vitamin E, St. John's wort, calcium, and folic acid. Third, make a complete supplement list and bring it to your next doctor's appointment. Everything counts. Powders, gummies, herb blends, sleep formulas, energy blends, all of it. Fourth, ask whether you actually need each product based on your diagnoses, your medications, your diet, and your labs. Fifth, if you have numbness, tingling, memory decline, easy bruising, black stools, severe constipation, new palpitations, or worsening balance, do not brush it off as normal aging. Get evaluated. And one more warning. If you are currently taking any of these and you are also on prescription medication, do not make abrupt changes without speaking to your doctor. Starting a supplement can alter drug levels, but stopping one can do it too. After 65, the supplement question is no longer, could this possibly help? The question is, what is this doing inside my specific body, alongside my specific medications, with my specific kidney function, liver function, and risks? That is a much smarter question. These 5 supplements worry me because they are common, they sound safe, and they can do damage quietly. Iron when you are not truly deficient. High-dose vitamin E when bleeding risk already exists. St. John's wort when medication interactions can change everything. Calcium taken by habit instead of by plan. Folic acid taken in high amounts while B12 deficiency hides in plain sight. If this helped you, subscribe to Wellness Daily and turn on notifications, because the next video is about another popular over-the-counter product adults over 65 use every week without realizing it can raise blood pressure, stress the kidneys, and interfere with heart medications. I do not want you to miss that one. And if you are over 65, write your age in the comments, because it helps me decide which topics to cover next.